Well, during this pandemic year, LEX18 wants to help you rebound. That's from ideas to help paying the bills to managing the pressures we're feeling. It's clear the pandemic has taken a toll on people's mental health. But how can parents tell the difference between general COVID fatigue and depression in their kids? Evening Edition's Kristen Edwards consulted the experts for this Rebound Kentucky.
The coronavirus has caused many of us to feel lonely this year. We're apart from our friends, sometimes family, and for kids, their classmates. Well, I talked to a couple healthcare professionals today to learn how parents can spot signs of depression in their children and what they can do to help.
What red flags should parents be on the lookout for in their kids to let them know that, they might be struggling a little bit right now?
Well, obviously, if your child is talking about suicide or has a preoccupation of death, then you need to talk to your pediatrician, mental health provider. You need to go right away. But for your average kid that's struggling, we see withdrawal, we see increase in sleep, we see a change in appetite, and just an overall irritability are some of the primary symptoms that we're seeing during this global pandemic.
Specifically for teens, Dr. Catherine Stone explains how to spot signs of depression versus typical moodiness.
If you see that your child is so moody that they won't interact with you for a couple of days, or you see rage, you see more aggressive behavior, non-compliance, you say, no, you can't go out, and they grab the keys and go, then you know it's time that you need to sit down and have a talk with them or reach out to a mental health professional.
Here are some things parents can try to improve their children's mental health. Limit or filter bad news, stay active and get outside. Focus on helping others. For example, as a family, you could make cards for the local fire station or your postal workers. Remind your kids that the pandemic will pass and give grace on classroom assignments and grades.
Right now, the switch to virtual learning for kids is an adjustment for everybody. So I suggest parents just, ease up on the grades, for goodness sakes, in the context of what we're going through right now. It's really honestly not that important. However, if there's a real change in how a child is performing and how they're interested in school, that would be a concern to try to develop more of an interest and try to understand what's happening there.
If you notice any of these symptoms, it's recommended that you visit your child's pediatrician. You can also call this local hotline to get some guidance on what to do next. For more resources to navigate this issue, you can head to our website. It's lex18.com. Kristen Edwards, LEX18 News.